Very comfortable here, a lot of room, and we appreciate you being here. Yesterday I announced that we would be extending our social distance guidelines through the end of April. This is based on modeling that shows the peak in fatalities will not arrive for another 2 weeks. The same modeling also shows that by very vigorously following these guidelines, we could save more than 1 million American lives. Think of that, 1 million American lives. Our future is in our own hands, and the choices and sacrifices we make will determine the fate of this virus and really the fate of our victory. We will have a great victory. We have no other choice. Every one of us has a role to play in winning this war. Every citizen, family, and business can make the difference in stopping the virus. This is our shared patriotic duty. Challenging times are ahead for the next 30 days, and this is a very vital 30 days. We're sort of putting it all on the line, this 30 days. So important because we have to get back. But the more we dedicate ourselves today, the more quickly we will emerge on the other side of the crisis, and that's the time we're waiting for. The more we commit ourselves now, the sooner we can win the fight and return to our lives, and they will be great lives, maybe better than ever. Today we reached a historic milestone in our war against the coronavirus. Over 1 million Americans have now been tested, more than any other country by far, not even close, and tested accurately. And I think what I'd like to do is ask Secretary Azar, who's done a fantastic job, to come up and just say a few words about the fact that we reached substantially now more than 1 million tests. Please. Thank you, Alex.
Well, thank you, Mr. President, for your leadership in marshaling all the resources that we have for this unprecedented testing effort. And thank you, Mr. Vice President, for leading a whole-of-economy approach to testing. As the President mentioned today, the United States hit more than 1 million samples tested, a number that no other country has reached. We're now testing nearly 100,000 samples a day, also a level that no other country has reached. I want to thank every partner that has been involved in this effort. That includes all of the men and women of the FDA and the CDC, including Director Redfield and Commissioner Hahn. Together, the FDA and CDC have worked to balance the need for testing on an aggressive scale with the scientific rigor that Americans expect. Working with our testing coordinator, Admiral Giroir, they have now truly unleashed the ingenuity of the private sector and our state and local leaders, the centerpieces of America's historic approach to testing. I want to thank those state and local leaders who've used their on-the-ground resources and knowledge to lead testing and make it much more easily accessible to the Americans who need it. I'm also grateful to FEMA, with whom we're now working closely to get state and local partners what they need. I also want to thank CMS, where Administrator Verma has given healthcare providers unprecedented flexibility to scale up capacity for testing and treatment and has ensured that tests will be paid for. Finally, we would not be where we are today without the many American companies, entrepreneurs, and scientists who have worked day and night to develop, as of today, 20 different emergency testing options. With the FDA responding to requests for authorization typically within 24 hours, the number of options is growing nearly every day. FDA has also opened up new options for using the available tests, like self-swabbing, and new options for reagents. I also want to thank FDA and other components of HHS for incredibly rapid action on other tools that we need. This weekend, we actually worked to secure 30 million tablets from Sandoz and 1 million tablets from Bayer of hydroxychloroquine and chloroquine, which are potential COVID-19 treatments, and we authorized Battelle's new decontamination machines, which can each sterilize thousands of essential N95 masks for reuse every day. So thank you, Mr. President, for your leadership, and thank you to everybody who's played a part in getting us where we are today. Thank you.
Thank you very much. Thank you. I'd like to ask Dr. Hahn to come up, FDA, because we have some really good stuff. First of all, the numbers have been incredible on testing, but in the days ahead, we're going to go even faster, and we have something from Abbott Labs, which is right here, and that's a 5-minute test, highly accurate. And I maybe can show that as we listen to our FDA commissioner, the job he's done, and the approval process. We talked about the chloroquine and the hydroxychloroquine just now. I thought that I'd mention it, but Alex has already done that. But we have that now under test with 1,100 people in New York, and it was only the fast approval by FDA that allowed us to do that. It was a really rapid approval. And Doctor, please say a few words. And this is the first one on the line of the 5-minute test from Abbott.
Thank you, Mr. President, for your leadership. Thank you, Mr. Vice President, for your leadership of the task force. I'm very proud of FDA's staff's work in the last few months to expedite the availability of testing in this country. I'm also incredibly appreciative of private industry's ingenuity and willingness to work with us quickly to develop and distribute those tests. We've had a substantial addition to testing with the authorization of point-of-care tests, especially the Abbott point-of-care test, which the President has pulled out of the box. A point-of-care test is a test that gives you a result where you're getting care. This is truly a patient-centered approach, whether it's the doctor's office, a hospital, an emergency room, an urgent care center, or a drive-by testing site. Just like tests for flu or strep, where you go to the doctors, you get the test done, you can get an answer within minutes of having this test done. Now, with those tests being approved for Abbott and for others, these are available around the country. They're planning to scale up the number of tests that can be put out throughout the country over the next month, and patients can get the answer within as little as 15 to 5 minutes. And then, of course, an appropriate plan of treatment can be given. We at FDA are working quickly with Abbott as well on other testing approaches, and normally these tests take months to develop. I was on the phone today with the Abbott CEO. He told me that normally this is a 9 to 12-month approach to developing a point-of-care test. They did this in collaboration with FDA and U.S. government within weeks. Abbott has shared that they will be delivering these tests tomorrow, and then we'll be ramping up. Just to emphasize one thing, the most innovative and safe products come from the private sector in partnership with government, taking an all-hands-on-deck approach, just like in this case. And the other point here is that Abbott and FDA worked together to make sure that we had a fast, reliable, and accurate test to market. Thank you.
Thank you, Doc. Great job, too. Really great job. Thank you, Steve. So, the pharmaceutical company, Sandoz, has been working with us very closely. And as Alex mentioned a little bit, 30 million doses of the hydroxychloroquine to the United States government has been given. And Bayer has donated 1 million doses of the chloroquine, which will soon be distributed to states and state health officials around the country. Teva Pharmaceuticals is also donating 6 million doses of hydroxychloroquine to U.S. hospitals, 6 million doses. So the private sector, as you'd say, Steve, it's been amazing what's happened, really amazing. And we're going to introduce you to some of the greatest business executives in the world today, no matter where you go. And they're going to say a little bit about what they're doing. And then we have so many more. The FDA has also authorized the Batil's N95 respirator mask sterilization kits. It's an incredible thing. I've been asking, why are we throwing these masks away? You look at some of these masks and they're significant pieces of equipment, and I say, how come you throw them away? Why aren't they using sterilization techniques? And I got a call from Mike DeWine, the governor of Ohio, and he's a tremendous guy, tremendous governor, and he said, we have a company named Batil, and they're having a hard time getting approval from the FDA, and I called up Dr. Hahn, and within a very short period of time, they got the approval. Steve, we really appreciate it. I want to thank Mike, and I want to thank Steve, and they're going to be able, each machine now can disinfect 120,000 masks per day. Now think of that. Each machine can disinfect 120,000 masks per per day. It'll be just like a new one. It can go up to about 20 times for each mask. So each mask can go through this process 20 times. And they have 2 in Ohio, 1 in New York, and 1 will soon be shipped to Seattle, Washington, and also to Washington, D.C. So that's going to make a tremendous difference on the masks. This morning I spoke to our nation's governors to help each state get the medical supplies they need. And yesterday, Vice President Mike Pence asked our nation's hospitals to begin reporting total bed capacity, ICU bed capacity, ventilator capacity, and vital medical supply levels on a daily basis. And Mike, thank you for the great job. Thank you very much. In New York, the 2,900-bed hospital under construction, which is now completed, they completed it in 3 days, you might say 3.5 days, at the Javits Center, will be completed today, and when you look, so they're going up, I think we're going to be adding some more beds, which will be completed today, and we've opened up, whoops, there goes our box, and my hair's blowing around, and it's mine. The one thing you can't get away with, if it's not yours, you got a problem if you're president. And nearly 3,000 medical beds will become operational. The U.S. Navy ship Comfort also arrived today, equipped with 12 operating rooms and 1,000 hospital beds. Work has begun on additional temporary hospital sites, including a 600-bed capacity nursing home facility in Brooklyn and numerous floors of a high-rise building on Wall Street. So it's been really pretty amazing what they've done. The Army Corps of Engineers, what they've done, they just completed, think of it, a 2,900-bed hospital in New York in just about 3 days, maybe 4 days. And the whole city's talking about it. On top of that, we floated in a great ship, which is going to be 1,000 rooms, which is being used for patients outside of what we're focused on, and that will free up a lot of rooms for what we're focused on. So it's been great. The Army Corps of Engineers has awarded contracts for the construction of alternate care facilities also at the State University at Stony Brook, State University Old Westbury, and the Westchester Community Center. We're sending 60 ambulances to New York City today. We have a total of 60. We're getting some additional ones, with up to 190 more to follow at different locations. To date, FEMA has obligated more than $1.3 billion in federal support to the state of New York. So we're spending a lot of money in New York. It's a hotbed. There's no question about it. And we're spending a lot of time, effort on New York, New Jersey. Spoke with Governor Cuomo a lot. Spoke with Governor Murphy a lot in New Jersey. And we're really getting the job done. People are very impressed, and I'm very impressed by the people in FEMA, the people in the Army Corps of Engineers, because what they've done, I've never seen anybody do anything like it. In addition to the 8,100 ventilators that we've already delivered over the next 48 hours, we're delivering more than 1,000. We're going 400 ventilators are going to Michigan very shortly, 300 going to New Jersey, 150 ventilators to Illinois, 150 to Louisiana, and 50 to Connecticut. FEMA and HHS already delivered 11.6 million N95 respirators, 26 million surgical masks, 5.3 million face shields, 4.4 million surgical gowns, and 22 million gloves. And I don't know if you just saw, it just came over the wires that Ford just announced just a little while ago that they will produce, along with General Electric Healthcare, 50,000 ventilators, and they're going to be doing it in less than 100 days. And top of that, we have other companies that are doing ventilators, including General Motors. But we have 9 other companies doing ventilators. As we outpace what we need, we're going to be sending them to Italy. We're going to be sending them to France. We're going to be sending them to Spain, where they have tremendous problems, and other countries as we can. but the fact that we're doing so many so quickly is a tribute to our great companies. More than 14,000 National Guard members have been activated and can help supplement state and local efforts to distribute personal protective equipment, where we're sending a lot. We have plane loads coming in. We have 51 loads from various locations all around the world, and they're landing. We had our first big cargo plane land this morning, and we're getting it from all over the world. And we're also sending things that we don't need to other parts. I just spoke to the Prime Minister of Italy, and we have additional capacity. We have additional product that we don't need. We're going to be sending approximately $100 million worth of things, of surgical and medical and hospital things to Italy. And Giuseppe was very, very happy. I will tell you that they're having a very hard time. Joining us this afternoon are CEOs of the great American companies that are fulfilling their patriotic duty by producing or donating medical equipment to help meet our most urgent needs. What they're doing is incredible, and these are great companies. Darius Domchek of Honeywell, you know that, and Darius has been somebody that I've dealt with in the past, and he's a great leader of a great company. Deborah Waller of Jockey International. A friend of mine, Mike Lindell of My Pillow. Boy, do you sell those pillows? That's unbelievable what you do. David Taylor of Procter & Gamble, and Greg Hayes of United Technologies Corporation. And I just want to tell all of you that America is very grateful to you and what you've done. Amazing job you've done, and we thank you very much. I'd like you to come up and say a couple of words, if you might, about your companies. Mike, come on up. Come on up, fellas, please. Come on up. You have to say what you're doing because it's been really incredible. Go ahead, Mike.
Okay, well, My Pillow is a U.S. vertically integrated company which has been forced to adjust to the changing business environment as a result of the pandemic. My Pillow is uniquely positioned as a U.S. company that functions as a manufacturer, logistics management distributor, and direct-to-consumer. Given our current business lines, we are experiencing the effects of this pandemic firsthand. But My Pillow is done. We've established an internal task force which is monitoring future needs of companies across the country as a result of this pandemic. And given our position, we've begun to research and develop new protocols to address the current and future needs of U.S. businesses across multiple sectors. How companies are going to prepare themselves when they once again open up and changes to their current operations in order to adjust to future threats and pandemics. My Pillow has designated some of its call center to help U.S. companies navigate the many issues that resulted from this pandemic. We've dedicated 75% of my manufacturing to produce cotton face masks. In 3 days, I was up to 10,000 a day. By Friday, I want to be up to 50,000 a day. I'm proud to manufacture our products in the United States, and I'm even more proud to be able to serve our nation in this great time of need. Thank you, Mr. President, for your call to action, which has empowered companies like My Pillow to help our nation win this invisible war. Now I wrote something off the cuff, if I can read this. Okay. God gave us grace on November 8, 2016, to change the course we were on. God had been taken out of our schools and lives. A nation had turned its back on God. And I encourage you to use this time at home to get back in the Word, read our Bibles, and spend time with our families. Our president gave us so much hope where just a few short months ago, we had the best economy, the lowest unemployment, and wages going up. It was amazing. With our great president, vice president, and this administration, and all the great people in this country praying daily, we will get through this and get back to a place that's stronger and safer than ever.
Thank you very much. Thank you, Mike. Appreciate it. Please come on up. I did not know he was going to do that, but he's a friend of mine, and I do appreciate it. Thank you, Mike, very much. Please.
First of all, Mr. President, Mr. Vice President, the entire administration, and all the agencies, thank you for your strong leadership during this time of crisis. It is noticed, and it's making a difference. Second of all, I'd like to say a big thank you to all the healthcare workers out there. You're putting yourself in harm's way every day, and we really respect what you're doing, and we couldn't be thankful enough for it. And I can tell you that more help's on the way. We as Honeywell, we're an industrial technology company. And one of the businesses that we're in, we protect the industrial worker. But what we're doing today is we're repurposing a lot of that equipment to serve the healthcare worker. A few days ago, we announced the startup of a new manufacturing facility in Rhode Island. We're going to be hiring 500 employees. We have already 200 on board, and we're going to be starting the production of N95 masks within the next 2 weeks. Furthermore, today we're announcing the startup of another manufacturing facility in Arizona. We're going to be hiring another 500 people, and we're going to be starting up production in that facility by the middle of May. So in total, we've doubled our production of N95 masks already. It's going to double again within the next 60 days, and then within the next 90 days, we're going to have 5x the capacity we do today. Furthermore, we're going to be providing other safety equipment to support all the efforts going on. Lastly, I'll say a big thank you to all the Honeywell employees, and also announce a $10 million fund for them, for all the hourly and administrative employees who are having a hard time during this time of crisis. Thank you, Mr. President.
Fantastic. Thank you. Normally I'd shake his hand, but we're not supposed to do that anymore. So that's okay. Great job. Thank you to Honeywell. Please go ahead.
Thank you, Mr. President and Mr. Vice President, on your guidance during this unprecedented time. And I'm very honored to be here today. Founded by a minister 144 years ago, Jockey International is a family-owned company headquartered in Kenosha, Wisconsin. Since 1876, we have been providing socks and underwear for generations of families. It is part of our DNA to roll up our sleeves and help our country in her time of need. During World War II, we made parachutes for the military. And today we are eager to serve this great country by providing support for the healthcare workers on the front lines of this fight. As the President and Vice President have said, it's a whole of America approach, and we are committed. Jockey has had a long-standing partnership with Encompass Group, headquartered in Georgia, serving the healthcare community. When we learned of the critical need for PPE, we knew we had to help. That meant restarting production on Tier 3 isolation gowns. Monumental lifting by Jockey, Encompass, FEMA, and the FDA was done in just a few days to be production ready. As a result, we expect to begin delivering 30,000 to 50,000 gowns per week, helping those that need it the most right now. In addition, this week, we are also donating 10,000 units of scrubs to the frontline doctors and nurses at the Javits Convention Center in New York City. We would not have been able to do this without the collaboration of the administration, representatives from the federal agencies, and Congressman Brian Stiles. Thank you very much, Mr. President and Mr. Vice President.
Thank you very much. Thank you. Fantastic. Thank you very much.
Thank you, Mr. President, Mr. Vice President, for bringing us together today. I'm proud to be able to represent the men and women of Procter & Gamble, who every day, 24 hours a day, are working to build and make essential cleaning products, hygiene products, and healthcare products for families everywhere. These include healthcare workers and for institutions that are serving those on the front line. P&G people are the faces of brands you know and trust. Brands like Tide, Pampers, Bounty, Charmin, Mr. Clean, and Vicks. In addition to making, packing, and shipping these essential items, they've worked together to transform our plants, to make things we've never made before, like hand sanitizers and facial masks. Some of these are already getting to national, state, and local agencies. Some of them are in the hospitals already. Everywhere around the world, P&G people are working every day to serve everybody, consumers, and they're working together to bring together the full capability of our research and development, our engineering, our manufacturing, and our communications capability to make sure we make a difference to the consumers we serve and to all the audience that we can make a difference to. I want to thank them, and I'm very grateful for what they do every day in service to others. Thank you, Mr. President, Mr. Vice President, for bringing us together today.
Thank you, Mr. Proctor and Gamble. Thank you.
Good afternoon. I'm Greg Hayes from United Technologies. And on behalf of the 240,000 employees of United Technologies and the 70,000 employees at Raytheon, which will join together with UTC this Friday, I want to first of all say thank you to the President and the Vice President for your leadership during what is really a war. It is a different war than anybody has ever fought before, but it's a war that we're uniquely qualified to help. As one of the world's largest defense contractors and some of the best technology, we're using that technology to try and solve some real-world problems. Today, we're working with the Air Force to try and help pilots as they're moving medical evacuees with the COVID-19 virus such that they can be protected and that the patients can be protected. Again, we're working also with logistics, and if you think about a war, strategy is important, but logistics wins war. And it's imperative, I think, with FEMA, along with Mr. Navarro's office, that we coordinate all of these activities. Last week, we donated about 90,000 pieces of personal protective equipment to FEMA. Next week, we'll have another almost 1 million. Again, working through our supply chain partners around the world. We're also today, this week, beginning the manufacture of face shields. Using the additive technologies that we have and the machines that we have available within UTC, we'll be able to produce approximately 10,000 shields in the next 4 weeks. Again, all needed equipment. We stand ready to help in any way we can. We don't need the Defense Production Act to ask us to act. All of the people at UTC and Raytheon are focused on this war and winning it. Again, I also want to say thank you to all of our employees for their work during this crisis, as well as to the frontline medical and other first responders. Thank you very much.
Thank you very much. Thank you, fantastic. Great company. Those are great companies. Thank you very much. I'd like to ask Seema to come up and say a few words about what you're doing and what's happening and how positive it's been. I really appreciate it. Come on up, Seema. Irma.
Thank you, Mr. President. And let me start by saying I want to convey my deepest sympathies to those that have lost loved ones to the coronavirus. We're all thinking of you. Today is Doctors' Day, and even without it, I want to send a message of gratitude to the foot soldiers in this war, men and women that are providing care and comfort to Americans that have been affected by the virus. Your country is grateful. And in short, as the President has said, we are engaged in a war against an invisible enemy. In wartime, the assumptions of peacetime must be revisited and adjusted to meet the demands of the moment. And so under the President's leadership, CMS is waiving a wide and unprecedented range of regulatory requirements. Now, many healthcare systems won't need these waivers, and they shouldn't use them if they don't need them, but the flexibilities are there. In a time of crisis, regulations shouldn't stand in the way of patient care. And there are several components to our announcement today, but the first one is CMS's Hospitals Without Walls. And this is going to allow hospital systems to create new treatment sites outside of their facility to expand capacity and be able to safely separate patients that are infected with the coronavirus and those that are not. Now, FEMA is doing incredible work setting up temporary hospitals in New York and other areas. But under these waivers, we are empowering local communities to complement and augment the work of FEMA and allowing hospital systems to tap into the capacity that already exists in their communities, making use of dorms and hotels or gymnasiums, and allowing the main hospital to focus on those that need the most intensive care. There are surgery centers out there today that are delaying elective surgeries, and they may have excess capacity that could be devoted to hospital-like care. And we are also making changes to the Medicare program to facilitate testing. So some people that need a coronavirus test can't leave their home, or patients that are in a nursing home. And now we will pay for labs to go out to these locations and perform testing. And we're also expanding the workforce. We are taking action today to relax some of our regulations to allow hospitals to increase their workforce. And we're allowing a broad range of flexibilities so that we can let healthcare workers operate at the top of their license And we are also allowing our hospitals to provide more support for our healthcare workers. Under today's regulations, they can only provide minimal support to healthcare workers, but now we're going to allow them to provide childcare, meals, laundry services. And then there's also telehealth. The President already directed a dramatic expansion of telehealth to our nation's 62 million seniors with Medicare, and we're so proud of all the healthcare providers and patients that have rapidly implemented telehealth. But today we're announcing that we're going to go even further, and we're going to be paying for doctors to make phone calls with their patients and provide care over the phone. And we're getting rid of long-standing barriers to telehealth in the Medicare program, allowing emergency rooms to use telehealth and eliminating requirements that some visits be provided face-to-face. And I also want to mention that on Saturday, the President directed CMS to offer advance payments for healthcare providers that are experiencing cash flow problems. We know that many providers are complying with our recommendations to delay non-essential elective surgeries, and they shouldn't be penalized for doing the right thing. Now, I've barely scratched the surface of all the flexibilities that we are offering healthcare workers and healthcare systems. These flexibilities will provide a lot of flexibility from regulations that are ill-suited to the unprecedented needs of this emergency. And doctors and nurses and other healthcare professionals that are working long hours and sacrificing times with their families and risking their lives will have the flexibility that they need to confront the needs of the coronavirus pandemic. And there are many heroes in this war, but I want to take an opportunity to thank the team at CMS. These folks have worked day and night. The flexibilities that are in this regulation, and any regulation, usually take CMS a year, but we did this in 2 weeks, and I couldn't be more honored and privileged to serve alongside these dedicated public servants. Thank you.
Thank you very much. You did a fantastic job, and you're doing a great job. So we are in the midst of something that is very difficult, but we are going to win. It's just a question of when. We want to do it as quickly as possible. We want to have as few deaths as possible. And we will meet again tomorrow for some statistics and some updates as to where we are, where we think we're going, and timing. I think timing is going to be very important because we have to get our country back. We have to get our country back to where it was and maybe beyond where it was, because we've learned so much. But we will have lost a lot of people, and in many ways they're heroes. And if you look at what's happening with our medical professionals, it's a danger. They're warriors. Men and women are doing a job that the likes of which I don't think anyone's ever seen. I see them coming out of planes today, going into New York, going into the most dangerous locations, dangerous areas, and they go in there and they just want to do the job. And you see the numbers. You see the numbers like I see the numbers. I have some friends that are unbelievably sick. We thought they were going in for a mild stay, and in one case, he's unconscious in a coma. And you say, how did that happen? So I just want to thank all of the great professionals, men and women, doctors and nurses and paramedics and first responders and law enforcement. By the way, if you look at New York and you see how the effect that this had on law enforcement, it's been incredible. These are great people. Firefighters, great people. They're helping in so many different ways. So thank you very much. And if you'd like, we'll take a few questions. John, please.